Hi, I'm Dr. Rahul Bagrecha, MDS, oral and maxillofacial surgeon, a university certified implantologist from Teeth and Faces Dental Clinic and Implant Center. Today we are going to discuss about dental implant. What is dental implant? Dental implant is a modern surgical tool which is used to replace a missing teeth. Dental implant is a cylinder-like structure. It is made up of titanium. Most commonly, it is made up of titanium. It has threads onto that, and the threads do have a micro porosities or micro irregularities on top of it. Dental implant is made up of two components mainly. One component which has a thread, which, as I told you about. This cylinder-like structure with the thread on top of it goes inside the bone. This is one part of a dental implant which replaces the root of your natural tooth. It is an exact replica of a root of a natural tooth. Second component which is fixed on top of this cylinder after 3 months most commonly when this cylinder is fused with your bone. The second component is used to fix the artificial tooth or a crown on top of this cylinder. Dental implant is most commonly made up of titanium, which is a bio-inert material. Sometimes it do have a positive effect onto bone, a native bone, which causes a positive deposition of a bone onto the surface. The micro irregularities and the threads on top of this cylinder are used for anchoring this cylinder actively into the bone, and the micro irregularities or micro porosities increases the surface area by which the bone which has been deposited onto the surface of this cylinder gets more surface area, so more anchorage and more fitting inside the bone. So the second component, which is called abutment, we come back after 3 months, and with the help of a screw, another screw, we fix this abutment with tooth attached onto this abutment into the cylinder body, which is hollow from inside. So the dental implant is most natural replica, as close as possible to the natural tooth as possible. How? So natural tooth has a crown part, the tooth part which is visible into the oral cavity. This is called crown. The second part, which is inside the bone, where this tooth has been anchored inside the bone, is called the root part. Dental implant, on the other hand, has the same thing. A crown part, the artificial tooth now, which is replacing the crown part, the tooth which was there in your mouth. And second, the root part, which is the cylinder with the thread which has gone inside the bone, it replaces the natural tooth root. The forces distributed into the tooth are from crown part, the tooth part, that the forces are biting forces. They are transferred from this tooth part, the crown part, through the root into the bone. Same way in the implant. The forces of biting are transmitted through the crown part, the artificial tooth part, through the root, that is the thread, the cylinder around the threads, and this whole structure, which is now exact replica of your root. It transfers the forces from the tooth part through this cylinder, through these threads inside the bone. Most common questions which have been asked to me are: is dental implant surgery painful? Do they cause allergies? Do they cause toxicities? And do they cause infections? So, dental implant surgery is as simple surgery, even simpler than your dental extraction. It just takes 15 to 20 minutes for placing a single implant, not more than an hour or two for replacing or placing a complete set. The implant required for placing a complete set, which is 6 or 4 in upper jaw, 4 and 6 in a lower jaw, doesn't take more than an hour or two. This is done under local anesthesia with very minimum gum separation from the bone, as less as your dental extraction, even lesser than that. Because of the precise drills what we use and the precise designing of the implant, the dental implant is very simple surgery to perform. Dental implant surgery doesn't last more than 15 minutes or 20 minutes apart from the settings which is required. Second question which has been asked to me is about allergies of the implant. Dental implant is made up of titanium, which is a bio-inert material. Bio-inert material are the materials when placed inside the body doesn't react to your body in any way, positively or negatively. They don't react, they're inert. Titanium is one of that material. Titanium most commonly used inside the body for any other medical procedures are the cardiac stents into the angioplasties, knee replacement implants, hip replacement implants. These are the implants which are used and made up of titanium which has been placed into the body, so they don't react. Third question is, do they cause infection? Dental implant, as I already told you, is bio-inert material. It's made up of bio-inert material, that is titanium. As they don't react to your body, they are not gonna create any problem. By the way, also, whenever the foreign body is placed inside your body, they don't cause infection, they do cause allergies or they do cause toxicities. So infection because of dental implant is not possibility. The infection which is there already into your oral cavity, into the gums surrounding your teeth, that infection may go through your gums, through your pockets which is there between your tooth and the gum, deep inside, and infect the gum, infect the bone. The situation is same like your infection around the natural tooth because of the gum diseases called gingivitis or periodontitis. So in periodontitis, the infection around the tooth, this infection is plaque, tartar, which has a lot of bacteria, which goes inside the gums, causes this infection inside the gums, causes the infection around the bone, and the bone level and gum level goes down. This infection now, it surrounds your roots, the bone which has been surrounding your root, it is resorbed, it goes vertically down, so there is no sufficient bone which is present around your root of a natural tooth, so it becomes loose and then it falls out. Our dentists extract that. Same with your implant. The infection which is there present around your artificial tooth now, the crown part, if it is not properly clean, that infection, that bacterial infection goes through your gums. Now the bone surrounding your implant and the bone and the gums surrounding the implants, they goes down, they resorb, implant become loose, and it comes out naturally. In some places it can be cured and reversed back, but infection from the oral cavity which causes infection of your natural tooth and implant, not otherwise. Third most common question which has been asked to me, rather a concern which has been shown to me, is dental implants are expensive. Yes, compared to your conventional bridges, the conventional bridges which are casting bridges, the casting bridges are the bridges which is made up of a procedure called casting, which is most commonly a metal fused to ceramic or a complete metal crowns. These crowns over the period of time or from the beginning only, they are not 100% fitting to your teeth. Over the period of time, because of the corrosion, there are chances of plaque accumulation at the border of your tooth, at the border of your artificial root, artificial crown and the root. Food accumulates there, it causes cavity, the infection goes inside the tooth, it may have an infection around your root, which may require root canal treatments or extractions, or the dental structure which is holding your bridge now, it is distracted so badly that it cannot hold your bridge now. You have to remove the bridge, you have to get new bridge made now, which is a longer span bridge. For single replacement, for replacing a single tooth, you require 3-unit bridges, but for replacement of 2-unit, that is 2 teeth, you may require 4-unit or 5-unit bridges. So you lost your existing bridge, you made a new bridge which is longer span, again a cost. Now add your inflation into it over the period of 4, 5, 6 years whenever this has happened, because this doesn't happen overnight. This doesn't happen in a week time or in a month's time. This takes years. But after 4, 5 years, whenever you come back, you see that because of the inflation, the cost of 5 unit is much more than what you have paid earlier. In case of implant, once the implant is placed inside the bone and you lose adjacent tooth, you don't have to remove this implant. You just add one more implant. If you lose 2, 3, 4 teeth, maybe one more or two more implants, and get a new set fixed with the help of existing implant only. In case of full mouth also, when you lose all your teeth, unfortunately, if you lost all your teeth when you grow old, you placed your first implant when you in your 30s and 20s, and in your 60s you lost all your teeth. So you just have to add 3 or 4 implants more. Minimum 4 implants are required now for replacing a whole jaw. There are studies, there are some modern implants which they claim that even 3 implants are sufficient, but most commonly it is 4 implants which is required. In some scenario, depending upon the bone condition, we do add 6 implant and 8 implant also. But placing full set in your mouth with the help of implant may require 4 or 6 implants, which is most common. So this implant, once it is placed, can be used for in your future prosthesis, your future teeth replacements, 2, 3 sets, or full mouth, or maybe a half jaw which you lost on one side. Long term, your dental implant will save you money because it is just one time what you have spent. Dental bridges will have recurring cost over the period of time. I'm talking about ill-fitting bridges. The modern bridges with a good quality material which is made with the very precision milling may not have these problems, but the cost then is comparable to your single tooth implant. A bridge made up of these kind of material and a single implant may almost be same. There are some disadvantages of these bridges. There are some limitations of placing the implants where we use these kind of bridges. We're going to discuss it in future videos. So dental implant is cylinder-like structure which has thread on top of it with micro porosities, which is bio-inert, which doesn't react to your body, doesn't cause any toxicities and allergies, which can be used for long term. If maintained, can last you for lifetime, help to replace a single tooth or multiple teeth. It can be used for fixing your existing denture, making them tighter, and it is very comfortable to place in. We're going to discuss about all the other uses of dental implant in all the clinical scenarios, how they can be used. Today, that is it. We'll see you in further videos. Thank you very much. I am Dr. Rahul Bagrecha from Teeth and Faces Dental Clinic.